The American Heart Association says only 44% of women are aware that cardiovascular disease is more fatal than all forms of cancer combined.
Live 5's Jenna Herrezo spoke with one local who is determined to change that and raise awareness.
Many may have decided to wear red in honor of today being National Go Red Day. The American Heart Association created the initiative as a way to remind women everywhere to take charge of their heart health. One Lowcountry woman is doing just that and more as she's using her own family's experience to motivate others.
And they had to do emergency surgery. They had to place a stent, which we found out most recently that the stent that they placed in 2009 is closed. So that isn't good. And right now there's so much that goes into it because the doctors are like, do we open it up? Is that going to cause more harm than good? But where her stent is, the tissues around her heart, they're dead.
Moncks Corner resident Brittany Nunez says her reason for spreading awareness is a personal one that started after her mother suffered congestive heart failure in 2009. Brittany says they learned this past December that her mother may now need a heart transplant. Cardiovascular disease is the #1 killer of women and accounts for 1 of every 3 female deaths each year, according to the American Heart Association. Dr. John Perry is a cardiothoracic surgeon who's worked in his field for more than 2 decades. Perry says women are just as much at risk as men, but says some doctors blow off women's symptoms.
There are still young females who present with cardiovascular symptoms, and there are times when it's ignored and not treated like a heart problem, and they're at significant risk for dying from a heart attack. So it's taken more seriously now over the last couple decades.
Brittany says the uncertainty of what the future holds has taken a significant toll on her and her family. But she says her experience has ignited a passion to help others navigate their own health challenges.
And just basically being support for those families that are going through a similar situation, whether it's emotional support or financial support, because there are a lot of out-of-pocket costs that are associated with transplants that insurance may not cover. So I just want to be able to kind of have or be that other person for them to lean on when they're going through a similar process, because being in the situation, we're completely lost and it was so overwhelming.
Reporting in Charleston, Jenna Herrezo, Live 5 News.
And women are often less likely to receive CPR from a bystander because rescuers often fear accusations of inappropriate touching, sexual assault, or injuring the victim. That's according to the American Heart Association.